The coronavirus pandemic has exposed gaping holes in Africa's healthcare system. And now the World Health Organization warns that Africa, which is home to 1.3 billion people, could become the next epicenter of this pandemic. According to a WHO study, the pandemic could kill up to 190,000 people in Africa in just the very first year if the spread is not contained. The study suggests the pandemic could infect between 29 million to 44 million people in Africa. These shocking projections are based on the assumption that no containment measures have been put in place. 47 countries in Africa currently have a total of more than 53,000 cases and more than 2,000 people have lost their lives. The infection wave has hit Africa later as compared to most parts, but the WHO believes that it could still translate into a prolonged, years-long outbreak if it is not contained. But that's not all. Another survey shows that for every 100,000 people in Africa, there is less than one intensive care bed and one ventilator in place. Clearly, Africa is not prepared to face the pandemic. On an average, 12 patients could be lined up for one ICU bed, and even in the best case scenario, the continent could need at least 10 times the number if the outbreak peaks. And not just the lack of beds, they're also unevenly distributed throughout the continent. Ventilators are also crucial in the fight against the disease. The entire continent has only 9,300 ventilators. South Africa has around 3,300 ventilators, but about two-thirds are in private hospitals, which most people cannot afford. Some nations, such as Guinea-Bissau, have no ventilators at all. But even with availability of equipment, the healthcare system in Africa is majorly understaffed. According to World Bank data, one doctor attends to an average of 80,000 people in the continent. Currently, the number of cases in Africa marginally low, but low levels of testing make it impossible almost to know the actual scale of infections. Africa has carried out around 685 tests per million people. This is in stark contrast to Europe's 23,000 tests per million. But even with that grim forecast, many African nations have moved quickly to contain the virus. Countries are restricting movement and repurposing factories to produce protective equipment to tackle the crisis. International organizations, including the WHO and World Bank, are currently providing assistance to the continent. The World Bank is helping more than 30 African nations with over $1 billion worth of equipment. And joining us live on the broadcast is our correspondent Michael Balek from Kampala, Uganda. Hi, Michael. If you can break down further for us how prepared Africa really is to deal with the impending crisis. Those figures are extremely worrying.
Hello, Molly. This definitely is a public health crisis, and coming to Africa, that is already facing other crises in terms of diseases. We're talking about Ebola, we're talking about yellow fever, we're talking about all other diseases, respiratory diseases like tuberculosis. It becomes a far-reaching crisis to Africa. It becomes a challenge. But of course, when we talk about, everyone thinks Africa is going to be the next hotspot. The WHO has said it. But this depends, and it goes from country to country, and different countries are preparing at different intervals and different times. For example, most African countries like South Africa and Uganda have put in place measures, of course, and these measures include stopping air travel, closing down their borders to other countries. They have stopped work. People, the countries are on lockdown, so people are working from home. And the only health workers are allowed to move around and basically in a way, to fight against this COVID-19, the spread of COVID-19. They have stopped social gatherings everywhere in Africa. And, of course, they are mobilizing. While Africa has their challenges, of course, which comes to access to equipment, like PPEs. When you talk about, and you've talked about enough ventilators, we don't have those ventilators in place. But the leaders are speaking. Today, the South African head of state has met other leaders in Africa, and they have discussed at length on how they can come together and actually fight this COVID-19 pandemic.
Right, and those projections in the WHO report are based on the assumption that no containment measures have been put in place, thus further highlighting the need for these lockdowns. Give us a broad sense of the restrictions that have been imposed in several parts and how effectively they have been enforced on the ground.
For example, in Uganda, we have seen that people cannot leave their homes to go and work. The government is encouraging those actually who can work, maybe to ride their bicycles, but they are not allowed to enter the city center. Crowds are not allowed. They have stopped churches. Mosques have stopped. We are in a fasting Ramadan season, but no Muslim is allowed to enter a mosque. And of course, when social gatherings, when you talk about social gatherings, there's no football anymore. People here in Uganda love football, but they cannot have football anymore. There is no public transport. That has been cancelled. And of course, even the people who are allowed to work, for example, the media, for example, the health workers, there has to be social distancing. And the military has been deployed at different places across the country to ensure that this happens. But of course, in other countries like Tanzania, this has not been possible. Actually, in Uganda, where I'm standing right now, it is for the last 50 cases have been that have come into Uganda have been from truck drivers coming in from Kenya and Tanzania, because in Tanzania, the president doesn't seem to think COVID-19 is a serious thing. So some of it's business as usual in Dar es Salaam and many towns in Tanzania. The airports is still open and people are still moving around and doing their business the way they can. So in those countries, it has been very difficult for them to actually implement and put in place those measures. But in Uganda, you cannot be able to do that. And also, of course, in order to reduce COVID-19, of course, there have been an increase in testing, especially with the help of WHO. Now we have so many tests that are being carried out within the country, and that's why we're seeing numbers coming up. Yes, they may be underreported, but they're coming up because there's more testing. While other countries are only testing those people who have symptoms, their symptomatic cases are not tested. But this is coming from country to country. But we're hoping that things may get better in the next few months.
Right, as with several parts, a low testing rate there also a huge concern. We're going to leave it there for the moment. Michael, thanks very much for those updates.